Hi guys, it's Pip from Sydney Advanced Physiotherapy here. Now we've done a number of videos for you lately to try and help you understand a little bit more about your body, about why you might have pain, and a little bit more about our clinic. Now one of the things we deal with is after a cancer diagnosis we help people recover. Now recovery can have all different meanings to a lot of different people, and a cancer diagnosis can have a massive impact on someone's life. It can change the way you feel about yourself, about your relationships with other people, and it can completely knock the legs out of you and make you feel completely fatigued. And sometimes that fatigue doesn't go away after all your treatment's stopped. I remember when I was 24, I was diagnosed with thyroid cancer, taking the dog for a walk around the block, and it was a small block, and then I was so exhausted I slept for 2 days. So the fatigue can be a real issue, and sometimes it's not something that's managed all that well. Another part of recovery for a cancer patient that isn't managed terribly well is scar tissue. So a physio can really help with scar tissue, and if you don't get on top of it early enough, the scar tissue can lay down quite thickly and be quite hard to manage, and it can really restrict your range of motion. Now often it's a scar that actually stops someone from going back to normal function and going back to the sports they were doing before, even after they've recovered, because they no longer have the range of motion and it's much harder to get the right muscles to activate. So it's really important that you see a great physio early on to help you with your scar management. Now obviously you need to talk to your oncologist or your surgeon and ask them when the right time to start physio is, because if your wound hasn't healed yet, now's not the time. The other thing we really help a lot with is the fatigue management. So setting up an exercise regime that is within the ranges of what you can manage to slowly help your body recover and to help you recover muscle function after you've had surgery is very, very important. It's really important that this is done by somebody who understands what goes on when you had cancer, and to understand the peaks and the troughs of the fatigue, and to understand that some days you'll feel amazing and some days you'll feel like rubbish. So it's really, really important that exercise be a part of your recovery. It is really one of the things that we see helps people with their self-esteem and their recovery the most, and it helps a lot with self-management as well if you can have your own program that you do at home. So what we find a lot is, for example, after breast cancer surgery, so often people have a lot of scar tissue up the top through here, through the shoulder. So it's really important that we manage that early so that they can get full range of shoulder movement back. But the other thing that happens is if they've had radiation therapy, the tissue can be quite inflamed and irritated for about 6 months, and so we have to work with that tissue very gently to optimize your range of movement and to give you as much space in the tissue and in between your ribs as possible. Now this space in between the ribs is very, very important. You have a lot of very important nerves and blood vessels that have to travel around your body, and what can happen if we don't do anything about it is that you can end up between the scar tissue and the radio getting some contractures around your ribs, and that can lead to all sorts of pain and nervy pain down your arm and things like that. And obviously these things are much better managed earlier rather than later. The other thing that we need to keep in mind with radio is that the tissue that has had the treatment will be changing for quite a number of years afterwards. It's quite a slow pattern, but you can go through periods where the tissue tightens back up and then relaxes, and it's really important that you know what to do when that tissue tightens back up to stop it from being a permanent change. And look, cancer recovery is a very specialized field. It is something that we work with quite a lot. So if you do have any questions about what we do and what we might be able to help with, please let us know, and you can send us an email anytime, admin@sydneyadvancedphysio.com.au, or you can always drop us a line on Facebook and send us a message or leave a comment, and that's totally up to you, however you want to contact us if you have any questions. If you think that this video might be helpful to someone you know who has cancer, or someone whose loved one has cancer, please share. We do want to help try and change the way people recover after a cancer diagnosis. We want to make sure that people are not feeling that overwhelming fatigue, or that they're not putting up with nerve pain that they don't have to tolerate. There's a lot of things that we can help with. We can also do lymphatic drainage, and that is a super important part of cancer recovery. So even though I'm 5 years in remission, because I had lymph nodes taken from this side, my body doesn't always clear the waste products of the day terribly well. So particularly when I get a little bit of sore tonsils or a cold, my face will puff up. Now if I just left that fluid can sometimes sit there and it can sometimes become permanent. So what I do is I book in an appointment with one of our massage therapists who specializes in lymphatic drainage, and I get them to basically drained my face for me. As awful as that sounds, that it's very gentle and it's actually quite relaxing, and my face feels so much better and so much lighter afterwards. And look, lymphedema is a really common part of a cancer recovery. So often people have had lymph nodes taken out from their armpit area after breast cancer surgery, but you can also get it. You can have groin lymph nodes taken out when you've had melanoma treatment, things like that, and you can have really puffy legs or puffy arms. And the most important thing is that you're vigilant with the management of lymphedema. So one of the first signs might be that your arm starts to feel a little bit heavier than it did before. You might not be able to feel any fluidiness in your arm, but it just starts to feel a little bit heavier. That's a really great sign that you need to go and see a quality lymphatic drainage massage therapist. And look, there are lots of things we can do to help you, and we can always refer you to somebody else if you need something that we don't do. So please let us know whatever we can help you with. We're happy to help. So as always, if you need any help with anything, please give us a call on 9416-4410, or you can always get us on the website, which is www.sydneyadvancedphysio.com.au, or Facebook.